Hi, welcome to Healthy Living. I'm Dr. Donald Pelto. Today we're going to be going over adult flat foot and posterior tibial tendon dysfunction. Also within this, we're going to talk a little bit about something called an accessory navicular. This presentation is for those people that are adults, not kids, and they have really bad flat feet. Many people have flat feet. You may have had an orthotic when you're a child, and you may not have any pain, or you might have a lot of pain. Everyone is different. A lot of times we see adults and they don't have any pain, but then they do a lot of activity and then they develop pain, and then we have to treat what those symptoms are. So let's get right into it. What is a flat foot? Basically, your foot collapses. So the ankle is going to collapse inward. Your heel is going to go outward. Okay? It's called hindfoot valgus. So basically the heel goes out and the ankle goes inward. One of the telltale signs is something called too many toe signs. So if you look at someone with a really bad flat foot from the back as they're walking forward, you're going to see that their toes go out. That's the too many toe sign. Things collapse into the ankle joint, and this affects a tendon called the posterior tibial tendon. The posterior tibial tendon, it comes down on the inside, right here on the inside, and it inserts around the area of the navicular, and there are some tendon sheaths that go to the bottom of the foot. This tendon, its whole job is to hold up the arch of the foot. But if you can imagine, if someone has a very flat foot, it's not able to do its job, and it's constantly trying to pull, constantly trying to do its job, and it can't. So the area of the tendon, it could get torn, it could get inflamed, there could be a problem. Not only that, what you're going to notice is that the joints in the foot, if they're not in the proper position like they should be, they could develop arthritis. Here's an example of a flat foot that's very flattened right there. You can see how everything is collapsed in. It's going to put a lot of strain on the tendon. And here's someone looking from the back. You can see the ankle going in, and you can see the tendon, Achilles tendon curved, and the heel going out. If you see someone like this, they probably have posterior tibial tendon dysfunction or a really severe flat foot. May not be painful, but it may be painful as well. Other problems that tend to happen with this type of a condition are bunions, hammer toes, arthritis, and callousing. Why the bunion? Well, when you have one tendon being pulled at the wrong angle, it can cause the other tendons to pull in a different way and cause someone to have a bunion. A bunion is a bump on the big toe on the side. Hammer toes are the contractures that can happen to the toes with rubbing. Typically what happens is something called flexor stabilization. If your foot is very, very flat, it's unstable, and your toes try to collapse and cramp down to stabilize the foot. Also, as we mentioned, if your foot is off or it's crooked over years and years, you're going to develop different types of arthritis in that area, and also because your foot's going to be rubbing in different areas, you could develop callousing. And one other thing, you could get a Taylor's bunion, which is a bunion on the outside of the foot. So this is the inside, this is the outside. There's a test you can do to see if your posterior tibial tendon is working well. It's called a single leg heel raise test. You stand on one foot and you go up on your heel, on your toes, and if your heel goes back into the right position, meaning this collapsing, it resolves and it makes it straight, then it's probably, your posterior tibial tendon is probably still working. If you can't do that, if you can't get up on your toes, or if your heel position isn't corrected, then what's happening is that your posterior tibial tendon probably isn't working that well, or it's a very severe case of this condition. As I mentioned in the beginning, there is something else that can happen that's called an accessory navicular. Once again, the posterior tibial tendon we talked about comes down and inserts in the navicular. And many times, if there's an accessory bone right here that's not painful, you may have had it your whole life, but if you pull really hard on that tendon, it could dislodge this accessory navicular, cause it to move a little bit, and then cause pain in that area. That's an example, and here are a couple of other examples of accessory navicular. Once again, this is the navicular bone, and this is a little accessory bone that could happen in that area. In all of these, you can see this is the talonavicular joint, so it's the talus with the navicular, and as it's off, as the talar head is uncovered, that means there's more flattening of the foot. How do you evaluate a flat foot? Well, X-ray tends to be very helpful for us. This is an example on the upper left-hand corner of a normal foot. You can see nice parallel lines. When you have more of a flat foot, you can see that the lines are a little bit off. The heel position, instead of being in this, the heel is a little bit down, tends to be a little bit more collapsing in that area. And here's an example of a very, very flat foot, very pancake type of a foot. That's going to be very hard for that tendon to hold up the arch of the foot. So an X-ray is essential for looking at this condition. Another type of a treatment or evaluation in terms of diagnosis can be with an ultrasound, especially if your posterior tibial tendon is painful. Once again, the posterior tibial tendon is the one that runs around the ankle, and you could look at a normal tendon or an area with some inflammation down here. Also a normal tendon, abnormal tendon because of all this fluid around the tendon. And this is how a tendon should look, nice and circular, but if there's fluid around the tendon, that's going to be abnormal. That can be done with an ultrasound. You could also get an MRI to evaluate if there's any tears or inflammation inside of the tendon, if the tendon isn't working well. What do you do if it's inflamed and if it's painful? Well, we start with resting it. If you're working with a problem around the ankle, I recommend a high walking boot, not a short one. A higher one tends to restrict things better, makes it feel better. Icing can be very helpful, anti-inflammatories. Cortisone injection can be done, but you have to be very cautious to not put too much in there, because if the area is already weakened or already torn, it could make it worse. It could cause a rupture. So if I do some type of a cortisone within that area, I would like to do some type of imaging prior, maybe an ultrasound, to see if there's any tear. Also, I would tend to immobilize this person. I would maybe put them in an Una boot, which is kind of like a soft cast, and then I'll put them in a boot like this to rest it for a week or two to calm everything down, so that while it's numb, they're not going to go and put too much pressure on the area that could possibly rupture that tendon. This is an example of a cortisone injection, approximately where it would be given to the area of the inflammation. That's the accessory navicular. If that's the problem, that's where you would give that. There is also a newer type of a treatment called Shockwave Therapy, or EPAT. This is showing an example on the bottom of the foot, but you could just as easily do this on the side of the foot where that posterior tibial tendon is. What this does is it uses sound waves. So as it hits the area, it actually increases more blood flow to the area to help bring healing into that area. If the tendon is very bad, if the inflammation is very bad, this probably won't work, but it's one of those non-surgical options for patients. If you have a tight posterior tibial tendon without a tear, but it's not working that well, or you want to help it to work better, foam rolling can be helpful. Physical therapy, trigger point tools, foam rolling, or the stick can be used. All these are to work on the posterior tibial tendon to reduce the tightness in that area. Correcting heel alignment. Once again, you can see here the collapsing of the feet. Using an orthotic, it's going to help realign everything. Once again, heels go out. You can see the toes on the side. That's called the too many toe sign. The whole idea of an orthotic is to have a deep heel cup that can swing everything in. And that is only done with a custom orthotic. You need to really correct this. You need to bring this heel and straighten it out. Sometimes, if the deformity or if the problem is too severe, an orthotic won't be sufficient. You actually need to go higher up, because there's only so much you can do on the bottom of the foot with an orthotic. Sometimes you need to go up higher above the ankle joint to give it more support. And this is an example of an ankle foot orthotic. You can see here it goes on the ankle up high and gives it more stability. There's a couple of different types. This one is an articulated, meaning you see that rivet there? That allows it to bend at the ankle joint. So if someone's ankle is still good, you would like this type of a brace. If someone has really bad arthritis in the area, in the middle of the foot, what these do is they straighten out everything. Here, this is called an AFO, or an Arizona AFO, that gives more stability. If these types of treatments don't work, there always is an option of repairing the tendon with a tendon repair of the posterior tibial tendon. You also may or may not want to fix the flat foot at that time. It's a lengthy procedure. It involves cutting through the bones and using screws and fixing that area of the flat foot if it seems to be necessary for you. If nothing works, if you're in a lot of pain, you've tried orthotics, cortisone, the ankle foot orthotics, and nothing works, then surgery may be an option for you. Surgery tends to require about 6 to 8 weeks for recovery. If you're working with the bones, if you're only working with the tendons, it can be a little bit less. You'll probably be in a cast for a large portion of that, and also off the foot for a large portion. There are risks with any type of surgery, so you have to really make sure that you need the surgery for this type of a condition, and you find a doctor that does a lot of these surgeries. Once again, there is a little personal website, and I'm going to put this on the bottom of the video if you'd like, this link to this Postwire page. Basically, it's a page that I use that gives you all the information that I would give my patients about this condition. Okay, you're going to find here a video about this condition. You're going to find some handouts, ideas about orthotics, AFOs, and everything else that you would need about this condition. I also like to end here with a little checklist of how to treat your posterior tibial tendonitis or tendon dysfunction along with flat feet. First, for the diagnosis, I would recommend an X-ray, maybe an ultrasound. If it's still not getting better, very painful, you're not exactly sure if there's a tear or not, you may want to get an MRI. Then the traditional treatments would include reducing the inflammation with icing, anti-inflammatories. Be very cautious with cortisone, especially if there's a tear, to not make anything worse. Shockwave therapy may be needed, maybe a good option if you're wanting to avoid surgery and help with healing. Also, there are some newer treatments called amniotic tissue therapy, where you take these great healing components and put them in that area. Once again, these are ways to avoid surgery. Reducing tightness with stretching, foam rolling, physical therapy, and then stabilizing the foot and the ankle with supportive shoes. So shoes always go first. Very nice supportive shoe or a boot that goes up a little bit higher could help. Next would be a custom orthotic, and then possibly an AFO or a walking boot. A walking boot is temporary. That's that high boot that I showed you. If these things don't work, there are some advanced treatments such as hydrocision. If you know it's only the tendon problem and you're not going to have to fix the flat foot, then there is a way that you can go in there and take out some of that bad material from the posterior tibial tendon. As well, an open surgery or a second opinion is always a good option. So here are some resources on posterior tibial tendonitis and flat feet, and I'll just be included at the bottom of this video. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.